the work that we're presenting at the meeting is inspired by the fact that while our group and other groups have developed imaging features or radiomic patterns from CT scans, the amount of validation that's been done on clinical trial data sets has been somewhat lacking. And so the work that we're presenting here is actually part of a partnership, a collaboration with AstraZeneca that's been going on for a couple of years now. And working with AstraZeneca, we were able to get one of their clinical trial data sets, CP1108. And the idea was that with this blinded data set, that we would get the scans, we would run our algorithms on these scans, and then send the results back to AstraZeneca for independent blinded validation. Very little of that independent blinded validation, unfortunately, currently takes place in the context of radiomics. And so we were very intentional and deliberate in this partnership that when the scans came, that we knew nothing about the clinical outcomes for these patients. We just got the scans. We ran our radiomic patterns, and in particular, we looked at our Delta-radiomics, which is to say that we looked at the radiomic features relating to the heterogeneity of the tumor and the peritumoral environment at baseline. And then we looked at the changes in the heterogeneity patterns of the tumor and the peritumoral environment after one dose of durvalumab. And the classifier, the machine classifier that we built, essentially looked at the change in the heterogeneity patterns of the tumor and the peritumoral milieu between the baseline and the post-treatment scan. And that was really used as an input to the machine classifier to be able to predict clinically relevant outcomes like treatment response as well as survival. And what was very nice, and which is what we're actually reporting in this poster, is that that blinded validation held up. In other words, we were able to get an area under the curve that was over 0.7 in terms of our ability to predict treatment response. And that was very, very satisfying because one, that we were able to demonstrate that these Delta-radiomics can add value, potentially add significant value over and above things like RECIST, which is looking just at change in tumor size, which we of course know has its limitations, particularly in the context of immunotherapy and immuno-oncology. But perhaps most satisfying was the fact that in an independent blinded validation, we really now have proof that on a completed clinical trial data set that these tools work and that these tools potentially could really add value for clinical decision support.